After surgery, your incision site becomes a focal point of your healing journey, and naturally, you want to ensure everything is progressing smoothly. It is perfectly normal to feel a bit anxious about whether what you are observing is part of a healthy recovery or if it is a sign that something needs closer attention. A surgical site infection often presents with a combination of specific signs. You might notice increased redness that spreads beyond the immediate incision line, significant warmth to the touch around the wound, pronounced swelling, and persistent tenderness or pain that gets worse instead of better. Furthermore, you could see a thick, colored drainage from the wound, often appearing yellow, green, or even dark, which might be accompanied by an unpleasant odor. Sometimes, a fever above 100.4 degrees Fahrenheit or 38 degrees Celsius can also be a warning sign, even without obvious local wound changes. These symptoms arise because an infection is essentially your body fighting off harmful bacteria that have entered the surgical wound. When bacteria colonize the site, your immune system springs into action, sending white blood cells to combat the invaders. This intense immune response creates localized inflammation, which is why you see increased redness, swelling, and feel warmth as blood flow rushes to the area. The thick, colored drainage, often called pus, is a collection of dead white blood cells, bacteria, and tissue debris, all part of the body's battle against the infection. Understanding this underlying biological process helps explain why these specific signs are so reliable in indicating a problem. To monitor your incision effectively, always wash your hands thoroughly with soap and water before and after touching the area. Observe your wound daily, preferably in good lighting, noting any changes in color, size, or discharge. Take your temperature regularly as advised by your care team. If you identify any of the previously mentioned signs of infection, such as spreading redness, worsening pain, increased warmth, significant swelling, or new or foul-smelling drainage, it is crucial to contact your healthcare provider immediately. It is important to distinguish between normal healing and signs of infection. While some mild redness and slight swelling around the incision are completely normal in the initial days post-surgery, especially as your body starts its repair process, an infection's redness tends to be progressive and expanding, rather than gradually diminishing. This spreading redness is often referred to as cellulitis, indicating bacterial spread in the skin. Additionally, normal wound fluid is usually clear or light pink, whereas infected drainage is typically thicker, opaque, and discolored. By understanding these key visual and sensory cues, you gain valuable insight into your body's healing process, allowing you to confidently differentiate between expected recovery and potential complications. This knowledge empowers you to act promptly if an infection is suspected, ensuring timely medical intervention and supporting your body's ability to recover smoothly and completely.